My name is Asiya Bihasovna. I am teacher from Dermatovenerology course. Today we again will discuss with you infection diseases of the skin. And name of our topic will be parasitic diseases. All parasitic diseases divide for scabies and pediculosis. First of all, let's discuss with you scabies. By epidemiology, this type of infection you can see from everywhere and everyone. It means that doesn't matter your nationality, country where you live, your gender or age, all of us can have this type of infection. The main cause of scabies will be specific small insect, mite, Sarcoptes scabi. The sizes of Sarcoptes scabi is very small, 0.3–0.5 millimeter. It means that by the visual examination you will never see Sarcoptes scabi, only if you will look for this insect under the microscope. In this picture you see the structure of Sarcoptes scabi under the microscope, and at the second picture you see how this insect seems or live in nature. You should remember that danger for person can be only female of Sarcoptes scabi. Male, if he will go under the skin of patient, will die and not provocate the signs of disease. Life activity for Sarcoptes scabi only 2 months. After 2 months, this insect will die. In nature, without human skin, Sarcoptes scabi can live only 5 or 7 days. It means that this insect can present in different tools which you use in your home or in job. How we can have this disease? We have 2 main ways of infection transmission. First way, it is straight way. Straight way means that you can infect it by ill person. For example, you live with this person in one house, or for example, you work in one room, or maybe this is your classmates. So the second way, it is indirect way. Indirect way mean different tools which you can infect it by the different tools which use ill person. It can be clothes or other materials which with which you will work together. Scabies, it is one of disease which have incubation period. Incubation period, it is time when patient have the first contact with ill person and when he first of all sees the signs or clinical picture of disease. Incubation period for scabies should be 8 or 12 days. That's why when you take anamnesis from your patient, you mustn't ask him what you do yesterday, with whom you have contact 2 days ago. No, you should ask him where you was, with whom you have the contact 1 week or maybe 2 weeks ago. So only after that you can think that diagnosis for this patient can be scabies. When Sarcoptes scabi go for the patient's skin, first of all, you will identify him or her under the stratum corneum of our epidermis. When Sarcoptes scabies first of all go under the skin of the patient, he with his specific mouth or specific legs which located on his body prepare and do the small point under the epidermis till stratum corneum. At the place where Sarcoptes scabies first of all go under the skin of patient, you will see small papilla or small vesicula. Then Sarcoptes scabi go to the stratum corneum and start moving. Insect moving, put eggs, eat the dead cells of our epidermis, and then sometimes again return for upper part of epidermis. In this place you again will see small papilla or vesicula, and then again return under the skin. Sometimes again go for upper part of epidermis and again return under the skin. Why this insect do these small points in our epidermis? It is very simple. Sarcoptes scabi do these points or open gauge in our epidermis for oxygen. By these small points in our epidermis, oxygen go under the tissues and Sarcoptes scabi and her eggs can breathe. If, for example, we will close these points and oxygen stop go under stratum corneum, Sarcoptes scabi and her eggs die very quicker. What you should know from the clinical picture of disease? We tell that primary lesion for scabies will be vesicular or papilla. In different patients, it is individual. If you will check the skin patient with scabies, you will see the long linear defect, and from all of these linear defect will present small vesicles or papulas, or sometimes it can be crust. Crust, it is a secondary lesion which you will see after vesicle when vesicular wrap and serum which present there start to be dry. So it will be linear defect with small crust which will located in this linea. Also, like a secondary lesion at the skin of the patient with scabies, you can see excoriation. What does mean excoriation? Excoriation, it is moving of our nails, yes, or of our fingers when patient feels strong itchy. So when patient feel itchy, he start itch himself, and these linears after our nails always will be visible at the skin of the patient. So this secondary lesion we call excoriations. One of the main symptoms which will present at patient with scabies will be nocturnal itchy. Nocturnal or evening itchy, that's why when you take complaints from your patient, you always should ask in which time your patient feel itchy more. If patient will tell that he feel itchy whole day, yes, you should think, okay, maybe it's a scabies, but for 30%, for example. But if patient will tell that, doctor, I feel strong itchy start from the evening and night time, 80% that it can be scabies infection. Why? Because Sarcoptes scabi, it's an insect which have specific biorhythm. What does mean biorhythm? For example, for person, for us, normal biorhythm, when we wake up at morning, all day we active, but at night time we want to sleep. The normal biorhythm for Sarcoptes scabi, it is a situation when whole day she sleep and she only wake up at night time and start moving. It means that her activity starting in evening and night time. She move, she eat dead cells of epidermis, she put eggs, and when these insects start moving under our skin, we start feel the strong itchy. That's why the main signs of scabies disease will be nocturnal itchy. Also, this type of infection have specific symptom which we call Ardii-Gorchakova symptom. What does mean Ardii-Gorchakova symptom? It is symptom when at the elbow region of patient with scabies you will see excoriations, crust, papula and vesicles. So it means that some lesion which will present at the elbow region of patient with scabies. Ardii-Gorchakova, it's a name of the authors who first of all opened this symptom. Scabies, it is disease which also have the lovely location. First lovely location for this disease will be place or skin between our fingers. Now, if you will take your finger and touch this place or skin between fingers, you will feel that in this region your skin is most thinnest. That's why for Sarcoptes scabies more comfortable go under your epidermis from this region, from this place. That's why patient with this diagnosis always or sometimes can have the localization of pathological process between their fingers. The next place where Sarcoptes scabi also can locate it, it is areolar region of mammillary gland in women. Also in this place our skin is very thin. At men these changes can locate it at the head of their penis. Of course, you will find the linears of the moving of insect in another part of the patient body, because how you understand, these insects always move. That's why you can see the rash in abdomen region, in buttocks region, in chest region. So that's why this disease transmits very quicker. So this is very short and main information about scabies infection, which I want to retell for you today. All other information about treatment we will discuss with you in our classes. Second disease which we must discuss with you in parasitic course will be pediculosis. Pediculosis, it is disease which more common you will find at the nurse practice, because mostly our nurse work with this problem, especially when patient come first of all for the hospital and they must be in this hospital 10 or more days. Nurse can work with this problem at the first time. So pediculosis, it is also a disease which you can see from different countries, different nationalities, at both gender in patient of different age. But of course, we should tell that mostly this disease you will find at the person who live at the street and don't have the house, at the person who don't save individual hygiene, or maybe at the person who have very low immunity and have the big problems with their internal organs. In real situation, we have three main classification of pediculosis. First of them, it is Pediculosis capitis, Pediculosis corporis, and Pediculosis pubis. By the name of this clinical form, you can understand where will localize the pathological process. First of all, we should discuss with you Pediculosis capitis. Insect which provocate this disease, we will call hair lice. Lice, it is insect which also live in our nature, but she have more big sizes than, for example, mite. That's why lice you always will see even by the visual examination. Microscope not need for you. So this is the structure of mite, how it's live in the nature, how you can see it by your visual examination. The way of transmission for pediculosis capitis can be also straight and indirect. Straight way, it is close contact with ill person. For example, you sit together with ill person. Yes, we have pediculosis capitis. Or by the different tools which use this ill person. For example, comb. How you understand by the name of problem, the main localization of pediculosis capitis will be our head region. At the man it can be mustache and beard region also. The diagnostic test for this disease is very simple. It means that you can put the diagnosis only after visual examination. So what everything what you must do it is open the head or hair region of your patient, and by the visual examination you will identify the eggs of this insect which will located at the near part of the patient kernel, and you even can see this insect which will moving under the hairs of your patient. Of course, by the symptoms your patient will feel strong itchy in this place, and this itchy patient will feel whole day, at morning, at day, at night, also without any stopping. The next clinical form of pediculosis we call Pediculosis corporis, and this disease provoked by another type of lice, we call it clots lice. These lice have more bigger sizes than hair lice, and mostly it will located in our upper part of patient body. It is the chest region, back region, hand, and etc. The main way of transmission also can be ill person, or for example one bed linear if you sleep with ill person together, or if for example you took his clothes. The main symptom of Pediculosis corporis, it is strong itchy from the whole of the body, and this type of lice drink our blood. It means that when this insect cut our skin, we feel this cutting and start to itch this place, and these lice drink our blood. So it means that she eat our blood, and when she cut our skin, from her saliva produce specific ferment. When this ferment go and reacted with hemoglobin of our blood, hemoglobin transform for hemosiderin. That's why patient with Pediculosis corporis will have blue or cyanotic colorish macules on the place where lice cut them. So that's why main clinical signs of this disease, it is a strong itchy from whole body of the patient, and white or violet colorish macules, which also will located at the place where patient itch his skin. The next clinical form we call Pediculosis pubis. This type of disease absent at the children because children don't have hairs in this specific region, and this disease provocated by another type of lice which we call pubic lice. These lice also can transmit it from us after the sexual contact, if it will be contact with ill person, or again by the tools which use this person with whom we live together. In this situation or in this type of pediculosis, lice also drink or eat our blood. That's why you also will see the blue colorish or cyanotic colorish macules at the pubic region, and patient will feel the strong itchy in this place. This is all information which I want to tell you about pediculosis. All information about treatment of this disease, prophylactic, etc. we will discuss with you in our classes. Thank you for the attention. Goodbye.